Hello.
Hi, I'm Lysandra Martinez. I'm going to be your nurse today. Can I have you say your name and date of birth, please?
Haley Slobosian, March 23rd, 1995.
Okay, thank you very much. So Haley, what we're going to be doing today is we're going to be doing a head-to-toe assessment just to make sure that you don't need any further treatment or evaluation. It's pretty straightforward. Just going to be inspecting and assessing you from head to toe.
Okay, thank you.
I went ahead and gathered all my supplies. I'm going to go ahead and provide for privacy. I'm going to complete hand hygiene. I'm going to don my gloves. And I'm also going to assess for pain. On a scale of 0 being no pain at all, 10 the most pain, do you have any pain?
0 pain.
Perfect, okay. And do you have to use the restroom? Do you feel comfortable?
Very comfortable and I don't have to use the restroom.
Okay, great. So I think it's a good time for us to go ahead and start the assessment now. I'm going to start with an overall general inspection. The patient looks comfortable. She has good posture. She looks well nourished, and she also looks clean and with good hygiene. I'm going to go ahead and take your vitals. So we'll start with that. I'm going to do your O2 blood saturation. I'm going to do your respiratory rate for ease of breath. I'm going to do your heart rate to make sure that, to see how hard your heart is working. And then I'm going to do your blood pressure. So we're going to check that. And then we're also going to check your temperature. Okay. After doing vitals, I would go ahead and start with my head to toe assessment. I would start with the head. First inspect, it looks symmetrical in shape. I would feel there's no bumps, no lesions, no lice. Everything is intact and looks good. Then I would go ahead and we're going to assess the cranial nerves. So we're going to start with cranial nerve 1 and 2, which is olfactory and optic. So for the olfactory, I'm going to go ahead and just get alcohol swab, and you can just, actually, I probably wouldn't tell them what they're smelling, so correction there. I'm going to hold one of your nostrils, and can you smell that?
Yes.
Okay, and then hold one more nostril, and can you smell that?
Yes.
Okay, so cranial nerve number 1 is intact. The client can smell that. Next, I'm going to do the optic. And for that, what I'm going to do is I'm going to have the patient hold this 14 inches away from her, and if you can please read the very first line.
About music, brought their dogs to work, and the festival I'd be working.
Okay, and she read everything perfectly, so that is a 20 out of 20. Then I would use the Snellen chart, and if you can please read the first 2 lines.
PTOC.
Okay, great. So she passed all of those as well. So that would be 20 out of 20 for the vision there. Next, I'm going to go ahead and move to cranial nerve 3, 4, and 6, which is ocular motor, trochlear, and abducens. And those all have to do with her eye movement. So the first thing I'm going to do is, okay, and if I can just have you stare straight ahead, I'm going to check for pupil size. So her pupil size is normal, about 3 to 5 millimeters. They are equal in size. They are round. They were reactive to the light. They did dilate. And then I'm going to go ahead and if I can have you just look at the light, the pen light. And then just stare straight ahead at it. Okay, perfect. So her eyes and pupils did accommodate appropriately and react appropriately to the light and the trochlear and abducens testing. So those are all intact, those cranial nerves. I'm going to go ahead and move on to the 5, 7, 8, and 11 for the cranial nerves, which are the trigeminal, facial, vestibular cochlear, and the accessory spinal. And so we'll go ahead and start with the facial. I'm going to have you close your eyes, and then you're going to feel either something soft or hard, and I want you to tell me where on your face that is, okay?
Right forehead, soft. Left forehead soft. Right cheek soft. Left cheek hard.
Okay, perfect. Next, I'm going to do the cranial nerve for the facial cranial nerve. So I'm going to have you smile, frown, puff your cheeks, clench your teeth, raise your eyebrows, and purse your lips. Okay, perfect. And then next, we're going to go ahead and do the acoustic. So what I'm going to do is I could do a rhyme or rubber, and if I had a tuning fork I would do that and I would place it on her head, but I don't have that, so I'm going to go ahead and do a whisper test. So I'm going to have her cover her ear, and if you could cover your ear, then I'm going to whisper something and just say it back to me.
Apple.
And then your other ear.
Banana.
Okay, perfect. So the acoustic nerves are intact. She was able to hear what I whispered to her correctly. And then next I'm going to do assess her accessory spinal. So if you could just shrug against the resistance. Okay, great. So that was all normal findings so far with the cranial nerves. Next I'm going to move on to cranial nerve number 9, 10, 11, which is glossopharyngeal, vagus, and hypoglossal. And those all have to do with the tongue and the movement of the tongue and the strength of the tongue as well as the taste. So I'm going to go ahead and do that first. If I can have you move your tongue side to side, up and down. Okay, and then I'm going to have you taste this and tell me if you can taste that.
Tastes sweet.
Okay, perfect. And I'm going to have you open your mouth and stick your tongue out against the stick. Okay, perfect. So I did also inspect her oral cavity while I did that. Everything was intact. I was able to see that her oral cavity is pink in color, moisturized, nothing white, no abnormal findings there. So next I'm going to go ahead and move on to the rest of the head to toe assessment now that we're done with the cranial nerves. So we left off at the head. I'm going to go ahead and move on to her neck. I inspected her neck. Skin looks good, intact. I'm going to go ahead and palpate for lymph nodes. And I don't feel any swelling of the lymph nodes. Everything feels normal there as well. I'm going to go ahead and inspect her carotid arteries. First, I'm going to auscultate them. Make sure I don't hear anything. If you could please hold your breath. That way, if we have any breeze, I can hear them. Okay, so nothing heard there, which is good. Next, I'm going to palpate one carotid artery at a time. And next I'm going to assess for trigger. Over here, just pinch her slightly. Skin trigger feels fine. Skin went back to the normal original state within 2 to 3 seconds, so that's good. I'm going to go ahead and do the thoracic and cardiac assessment next. So I'm going to start by auscultating your heart. Actually, I'm going to look at the thorax first. Thorax is symmetrical, thorax is intact, warm temperature, and then I'm going to now auscultate her heart. I'm going to start at the atrial. I'm going to go from atrial to, let me just say it as I go. Alright, so first it's going to be the second intercostal on her right, which is atrial. Then second intercostal on her left, which is pulmonic. Third intercostal on the left, Erb's point. And then tricuspid is next, which is fourth intercostal on the left. And then her mitral, which is the fifth intercostal on the left. And I'm gonna listen on the mitral for a whole minute. That's also known as the point of apical pulse. So I would listen there for a minute, and then I'm gonna go ahead and listen again with my bell, all the states. So atrial, pulmonic, Erb's point, tricuspid, and apical or mitral. Okay. And next I'm going to listen to her lung sounds. So one breath is going to be one inhalation and one exhalation. So if you can do that for me, and then I will start. Go under here. Okay. So while I was doing that, I was listening to her breathing sounds, which were normal, unlabored, no wheezing. I heard S1 and S2 sounds at the appropriate sites. Normal findings with that. Next, I'm going to go ahead and examine the posterior of the lungs and listen for the breathing sounds in the back. I would do also correction when checking and doing the cardiac assessment. I would do it under her shirt just to get the most accurate reading as possible, and I would also do this assessment with her shirt off, and I would listen at all 10 appropriate sounds. Okay, and again, the client's or the patient's breathing is unlabored, rhythmic, and no abnormal findings there. So now I'm going to go back and we're going to continue with the upper extremities. I'm going to go ahead and get her radial pulse. And then brachial. Next, I'm going to check, your arms. The skin is intact, even in color, feels warm to the touch, so good temperature. Next, I'm going to check the range of motion in the arms. So if I can have you push up against me, okay, and then flex your elbows up, and then push down. You grab my fingers, okay, perfect. And then next, I'm going to go ahead and move down to the abdomen. The abdomen is a little different than the rest of the body because I'm going to inspect first, and then I'm going to auscultate and percuss and palpate afterwards. So first I would have her show me her abdomen, which I would inspect, make sure that there's no bumps, nothing protruding, and then go ahead and listen and start at the lower right quadrant for vowel sounds. Lower right quadrant. And then upper right, upper left, and lower left. Okay, and I did hear normal vowel sounds, and then I would go ahead and percuss and palpate. So lower, and then just lightly palpate in the same order. Okay, and then next I'm going to go ahead and move to the genitals. Make sure that there's no abnormalities, that the client doesn't have any concern that there's no warts, no rotation, no abnormal discharge. I would check for the femoral pulse. Then I would go ahead to the lower extremities. I would check her popliteal pulse. Pulse is present and equal on both sides. Then I would check her pulse at dorsalis pedis, just right up here. And then at her posterior tibular, which is in the inside under here. And her pulses are equal. And then next I would check the range of motion in her feet. I'm gonna have you push. Okay, I'm gonna have you pull towards you. I'm gonna check the capillary refills on her nail beds, which are normal, filling back up in about 2 to 3 seconds. And can you bring your left foot towards you? Bring your knee up, just checking range of motion, and then with your other leg as well. Okay, perfect. So no abnormal findings there. Next, I'm gonna go ahead and assess your gait and balance. So if I can have you stand and please walk towards me. Okay, normal balance and normal gait. The client is balanced and coordinated. There's no tremor in her walk or anything like that. And then next, I would check her balance. I'll have you close your eyes, put both feet together and hands side by side. And if you can just lean against the resistance. Okay, on one side, perfect. And then on the other side. Okay, so my patient is balanced. I would document all of my findings. Overall, my client is healthy and in good condition. No abnormal findings for any of my assessments. I would make sure that the bed is in the lowest position with the rails up. Also, I would leave a call light next to Haley. Haley, I'm going to leave this call light next to you, but is there absolutely anything else you need from me?
No, thank you.
Okay, perfect. We are all done with our head to toe.
All right, thank